Good evening and thanks for joining us. We begin with what is happening in long-term care homes in parts of this country. Community spread of COVID-19 is beginning to seep into care homes again. British Columbia reported 4 new outbreaks in long-term care homes over the weekend. There are now almost 20 long-term care, assisted living and acute care facilities with outbreaks in that province. In Ontario, 86 long-term care facilities now have outbreaks and more than 1,900 residents have died in that province. Nationally, about 80% of COVID-19 related deaths have been in long-term care. Hiring and retaining enough staff to work in them remains a huge issue. As Mike Drolet reports, the solutions being looked at are nothing more than Band-Aids.
The first wave of COVID-19 put a wall between Maureen McDermott and her mother.
I can't tell you what it was like to visit my mother outside of a window with COPD, dementia and Alzheimer's at 93, and getting COVID.
Miraculously, she survived, but when her long-term care home opened its doors in July, the figurative wall between mother and daughter remained. She no longer remembered Maureen, who is now fearful and anxious of a second wave.
It's like a PTSD that's just creeping up that we're going to have to go through this again. So these plans need to be in place with no questions.
Except there's a lot of those. Donna Duncan, the director of the Ontario Long-Term Care Association, told an independent commission she expected solutions over the summer. Are we ready? We're concerned that we're not. She added that staffing remains a critical issue. With lower pay and benefits than hospital workers who do the same job, long-term care homes have had problems retaining, much less hiring new staff.
You know, calling them heroes on the front line or throwing them a couple extra bucks here or there for a few months, that's temporary. We need a solid, permanent solution.
In the spring, Prime Minister Justin Trudeau sent in the military to the hardest-hit facilities. For the second wave, he's announced funding for the Red Cross to hire staff to help personal support workers with the basics, such as socializing with seniors, feeding them, and making sure they're safe. And as to the qualifications needed to apply for the job, it comes down to you have to like seniors and pass a police check. Standards industry insiders say would have been unthinkable pre-pandemic.
Because if you're trying to move somebody and they're a 2-person lift and there's nobody else to help you, you're going to grab somebody who's available, and that's going to be an untrained worker. And that's unsafe for both the worker as well as the resident.
The job postings have been up for just over a week. The Red Cross declined to say how many Canadians have applied.
Well, I think we've learned something. The question is, have we provided any solutions? And I think those are 2 different questions.
Mike Drolet, Global News, Toronto.
The outbreak at a Spinco studio in Hamilton, Ontario has turned into a cautionary tale of exponential spread. The city of Hamilton has created a graphic showing how what started as one infection has led to at least 74 cases of COVID-19 in the community. The graphic shows that one case led to 48 infections at the Spinco studio in downtown Hamilton and then spread more widely, infecting people in 15 households, 8 schools and childcare centers, 6 healthcare facilities, and 22 other workplaces. Hamilton's medical officer of health says that happened even though the Spin Studio and its patrons followed all public health guidelines for fitness studios. The province is now reviewing those guidelines. In Quebec, frustrated healthcare workers disrupted traffic on 2 bridges today, demanding better working conditions. Nurses and other healthcare workers briefly blocked traffic on the Quebec Bridge in Quebec City and on the Jacques Cartier Bridge in Montreal. Union representatives say the pandemic is putting a strain on the healthcare system and say workers deserve more stable schedules, improved nurse-to-patient ratios, and more full-time positions. Quebec reported more than 1,000 new cases of COVID-19 today.